So Kristen, let me ask you, what has been your experience using the Parp inhibitors?
So our hospital has been very involved in Parp inhibitor trials. You touched on Olympiad and Olympia. We've also participated in the Brocade trial, which looked at veliparib. And most recently, we've been involved in the olaparib expanded trial. We've primarily used olaparib, but we've used other Parps and certainly are aware of the potential differences and side effects.
And so what questions do patients typically ask you when you're going to start them on a Parp inhibitor?
Really general questions. They want to know, how effective is this? How effective has it been with other patients? They want to know, how is it given? What are the side effects? Because we're currently using this in metastatic patients, these patients also want to know how they will be screened while they're receiving a Parp inhibitor. So how often will I have imaging? What type of blood work will be done?
So in general, I would say that the Parp inhibitors are extremely well tolerated. It's probably worth noting that in both the Olympiad and the BRCA trial, only 5% of patients actually stopped their Parp inhibitor because of side effects. I think the typical patient may have very mild nausea, for which we can use standard anti-nausea medications, and very often with continued use, the nausea actually gets better. There might be mild fatigue, perhaps occasional mild headache. I would say with olaparib, sometimes there can be anemia, and rarely it is significant enough to require a transfusion. But with olaparib, there's very little lowering of the white blood cell count or the platelet count, and there's no hair loss. With talazoparib, I would say very similar, but perhaps a bit more in the lowering of the blood counts, a little bit more anemia or lowering of the white blood cell counts or platelets. And 1 out of 4 women who use talazoparib do have some mild hair thinning.
Can you actually discuss how we administer Parp inhibitors and how we follow patients while they're on a Parp inhibitor?
Yeah, sure. So these are oral medications. They are pills. For olaparib, it's generally 2 pills twice a day. For talazoparib, it's 1 pill once a day. And we typically see patients once every 3 weeks. Patients are on the medications, the pills, every day continuously, no breaks. And we really encourage patients to email or call us with any side effects, because we do have strategies to help with any of those side effects. As we mentioned, for example, anti-nausea medications. Sometimes we need to lower the dose of the medication, and that's all that's needed to help with a side effect. And so we really encourage patients to call us, and also to really adhere to taking the medication, particularly for the first 90 days. And that's really important, because that's the next time that we're going to image or restage the cancer to see if it's responded. So really important to try to stay on it for 3 months so that we can see if it's working. And again, also because for some of the side effects, interestingly, with continued use, they actually decrease. So Kristen, do you have any other thoughts about how to help patients adhere to taking the medication, or strategies that might help?
Ensuring that patients know that we're always available to talk to them about side effects that they might be experiencing is often the most important step to take. When patients are able to reach out to us, they can let us know what they're experiencing. We always run it by one another. We work in a team model, including the patient, including any caregivers. We discuss ways that they've already tried to help manage these side effects, and we brainstorm other ways that they can help manage these side effects.